All right, guys. So we are getting started here. I'm testing everything out, and we are going to get Jason on here really soon. Bear with me as it's my first time. And if you're watching this at a later date, then you can skip forward a couple minutes when we get Jason on, and we will really start chatting. Okay. Hi, everybody. So I just opened up this and I'm going to get started. We're going to get Jason on here in just a minute and get everything started. Bear with me as I learn how to do this. Let's see here. Hi, everybody. Okay, perfect. Oop. Let's see here. Where is this? Great, let's see here. Where is this button? Okay, so I can see English. I see Marie. Hi, guys. Where is everybody else in this? Jason. Okay, perfect. Okay, here we go. Hey, there we are.
Okay,
How's it going, Jason?
doing well. How are
Good,
you?
good. Awesome. Well, I'm excited to have you on here. And like I kind of told I was kind of saying as I was trying to get everything set up, I was like, this is going to be a little bit of a, bear with me because it is the first one that we are doing here. But I'm really excited and super excited to have you on joining with this. The goal with these mastermind lives is really to help bring together healthcare professionals, professionals in the space like yourself who are really knowledgeable in these like really cool areas, and the people who really resonate with that holistic health theme that we really you and I have chatted about a whole lot. So that's one of the reasons why bringing you on here is just like like super resonates with myself, and I think will resonate with everybody who's in this group as well. So yeah, thank you so much for being here, first off. And for those who don't know, Jason is a physical therapist, doctor of physical therapy, and he has his own clinic here in Chattanooga as well, and definitely has a very cool niche. We bonded over talking about, you know, different aspects of meditation and from the yoga perspective, all of that. So when we first sat down, we had coffee at Common House, and it was supposed to be an hour meeting and ended up being 2 hours. So I know that we could talk forever. I'm sure there will be several more conversations at some point, but I, you know, I'm super happy that you're here. And why don't you go ahead and maybe give people a little bit more of an idea of background on yourself and kind of your practice and everything like that.
Sure. Thanks for having me, Libby. This is really
Yeah.
exciting. So I'm a physical therapist. I've been practicing since 2011. My practice is called Insight PT and Coaching, and it's located in Hickson on Dayton Boulevard. I do a lot of work there, but also do a lot of work virtually through individual offerings, one-on-one, and also group offerings like classes and workshops. I started off my career in skilled nursing, actually, so I was helping folks in that subacute phase of rehabilitation after they've left the hospital but aren't quite ready to go home. And after a few years, I decided to try out outpatient, and that led me to the realization that a lot of folks that I was working with chronic pain in particular, the things that I had learned in school and from other clinicians over the years, well, they just weren't making the difference that I was hoping for. And that really challenged me and bugged me. So I decided to take a deeper dive into understanding things like pain and chronic pain in particular. Mm-hmm. So that was back in 2015, 2016. And since then, I really haven't looked back. I've just spent a great deal of time better understanding and trying to learn more about chronic pain and all the things that contribute to it. Mm-hmm. And what our place and our role is as physical therapists and coaches, I think, to help people who live with chronic pain or chronic illness and what they can do for themselves. So that's where, you know, things like mindfulness start coming in, and mm-hmm. I'm sure we'll talk about that too.
Yeah, all of that, right? So like when you think about pain science and like pain and the brain, like a lot of people think, and they've been told, you know, that like there's just like damage is pain, and like there's all of these, there's a lot of lack of information of maybe not available because it is out there, but like that most people know is out there when it comes to pain science. And as a physical therapist, we learn about this in our schooling, but most of the general population doesn't really understand pain, really. So if you were going to just kind of explain to kind of the general person about like pain and like the brain and maybe like that kind of pain sciencey thing, how would you kind of just give somebody a little bit of insight, like kind of the starting of to kind of understand what pain is and how it works in the body?
Sure, yeah. First, I think you and I graduated from PT school at different times. When I was in PT school, we didn't learn a lot about pain science.
Okay, yeah.
I'm glad to know that that's actually been more part of the curriculum and more PT programs. Yeah. In fact, over at your school that you graduated from, UTC, they have a pain science elective now, which I've done a couple of guest lectures there. So anyways, I'm glad to know that the profession's learning and understanding more about pain, but I think we have a long way to go. Mm-hmm. For the patient or the person who lives with pain or maybe has endured persistent pain at some point in time in their life, I think one of the first things I just try to help emphasize and help people understand is that pain is gray. It's never a black or white picture. It's not just one thing like what maybe shows up on your MRI or X-ray. Mm-hmm. It's not just something like posture even. It's also not just in your head. I mean, yeah. Pain science is brain science, to be clear. Yeah. You can't feel anything without your nervous system. So kind of, no brain, no pain, right?
Right.
But there are a lot of things that contribute to that process, including what shows up on your imaging,
Mm-hmm.
including how you move and hold your body, but also other things like, um, for example, things like sleep. Not many
Mm-hmm.
people realize that not getting adequate sleep over a period of time has an aggregate negative effect on your body, including your nervous system and your immune system and other systems.
Mm-hmm.
And that's going to have an impact on how much you hurt. So it's not to say that pain has nothing to do with damage. It's just never quite a one-to-one relationship. So the amount of pain you experience, the frequency with which you experience it, the things that it might limit you from doing,
Mm-hmm.
is complicated, and there are a lot of factors that contribute to that. And the good news about that is that that means there's more area for a person to participate in their health and to take care of their bodies in new ways. So, and there are other, metaphors I like to use to help people understand pain, and we can maybe get into those. But I think
Yeah.
the main thing is to just remind folks that pain is gray, and that there are a lot of things that are just either underemphasized or not discussed at all.
Mm-hmm.
One big example besides sleep would be tension. And
Yeah.
and one thing that I've found is that when you teach a person how to physically relax their body and as a result calm their system to some
Mm-hmm.
degree, it helps with pain too. It helps them feel better and move with more ease and efficiency. And that looks like breathing techniques and relaxation techniques and other things like this. And then, that might open up a conversation to what might be driving some of that tension. Like, I think one thing that we'll probably come to eventually in the conversation is stress and how that
Yeah.
has
Well, that's what I was
significant.
gonna say. Yeah, next is like stress is a huge one, right? And like I find that when I'm educating people, a lot of times when I can give them, even if they don't need to know all the super technical things, but I think sometimes when people have a basic understanding that, stress, daily stress, whether it's from your job, your work, like relationships, physical stress, like all of these things, right? That it like increases hormonal responses like cortisol or things that actually make you more like makes pain feel more acute. And I think sometimes when people have the ability to know that it's not that it's just like they're not just like making stuff up or anything like that, that there's actually like a chemical process that's happening to make them more acutely feel pain that maybe is proportionate or could be disproportionate to the physical kind of quote unquote possible damage or disruption or whatever it is. And I feel like that's such a big thing. Like stress management is so huge. And I know that with you and your practice, like mindfulness and all of that kind of comes into play. So when somebody is dealing with, a significant amount of stress, just depending on where, maybe in several facets of their life, what are maybe some, it could be mindfulness techniques, meditation obviously maybe comes into play with that, or breathing. Like how might you approach that with somebody? And every person is different, and I'm curious to know your take on this too. Because like some people that I've talked to, they're like, well, like I don't do yoga because like, it goes against my like religious values or something like that. It's like, okay, well, we don't have to call it yoga, but we can have these practices of mindfulness in some way, or it doesn't have to be meditation. It can be prayer, it can be different things. So how do you kind of go about teaching that, or kind of explaining that to people and working through that with them? There's
Yeah,
so many ways to do it, right?
yeah, that's
It's a big question.
yeah, that's a big ball of yarn to unwind. So first, it just kind of, as you said, it depends on the person and their level of personal understanding, like how well they are aware of themselves.
Mm-hmm.
One thing I start with just by just bringing up and just seeing how it resonates to kind of gauge where they're at and what they're ready maybe to explore further is if I said that being in pain all the time was stressful, would I be
Mm-hmm.
crazy? And obviously not.
Mm-hmm.
I mean, pain can be very frustrating and
Yeah.
disappointing and scary. Like, if it's like this today, what's it going to be like in the future? So
Right.
pain is stressful, right? But what if I said that stress makes pain worse? And 9 times out of 10, I'll get at least a nod. Like, there's an understanding on some level that the amount of stress that they might have in their lives, day to
Mm-hmm.
day, week to week, month to month, um, it does affect how much they hurt or where they're hurting and how limiting that pain might be for them. So I think I just start by getting a sense of how comfortable they are with the topic a lot of times.
Mm-hmm.
And then for others, sometimes it's more of a indirect revelation for them. So for example, I'll teach them breath work. I'm always eager to jump into the mindfulness conversation.
Yeah.
There's a big conversation to be had, and we can talk about the difference between meditation and mindfulness, and the different kinds of meditation, and how mindfulness can be applied to everything. And I'm a big advocate for using mindfulness in your day-to-day life. But just with breath work, so there's a lot of different breathing techniques out there too, and I'm not saying that there's a best one or a right one for each person, but if I just introduce the fact that they hold their breath sometimes, oftentimes, and that when you hold your breath more, you do tend to tense up more in your body holds more tightness and contraction. And then if you utilize your breath to just maybe ease some of that, just release a little bit of tension in your shoulders and in your jaw and maybe in your belly or your hips, if that has any degree of impact on how much they're hurting in the moment, then it might spark a little more curiosity. So I start with breath work and other sorts of mindful movement practices. I don't call them that because, again, that, maybe not everyone's ready for that language. So just being like aware of your body as you're moving it. And if that starts to make a difference, and it often does, then we start getting a bit more curious about, well, what's going on upstream that's causing this downstream breath holding and tension? What might be driving some of that, stress or fear or frustration with life or whatever it might be. And then, we'll go from there. As far as the mindfulness part goes, I'll just be real brief about that. We can dig in more if you want, but, mindfulness isn't religious or spiritual. It's just a way of paying attention. We all have had moments of mindfulness in our lives. And to try to paraphrase the definition for it, it's just paying attention to what's happening in the present moment, moment by moment, without judgment or resistance. So allowing what's here to be here moment by moment. And as simple as it is, it's really hard to do. It's hard to maintain that moment to moment awareness or presence, or however you might want to describe that. But there's a lot of upside to doing so. And I can tell you more about that if you're interested.
Yeah.
But it's not the same thing as meditation necessarily, although mindfulness meditation is a fantastic way of cultivating more of that presence.
100%. And it's really interesting how all of these things, just like with all of the health stuff that, we kind of have all talked about it all comes together, right? There's meditation practices, but they can look like different things. And some of them include mindfulness, but not always. But then mindfulness is its kind of own thing here. And that can be included in these different things. And you can kind of shuffle and piece these things together and make it work for you, or each person can make it work for themselves within the context of their lives or, their environment or whatever it makes sense for them. And I tell people a lot of times from a mindfulness perspective, I don't know, maybe you agree or disagree with this, but a lot of times mindfulness is the space between. I kind of say it's okay, there's a thought or maybe an action, and then there's mindfulness between then the reaction or whatever. And those could be internal actions and reactions, a thought comes up and then we have a reactive thought to it. But mindfulness is that awareness in between the kind of initial action or thought or whatever it is, and then before the reaction. And it's hard. Like you said, a lot of times the simplest things, as we know, sleep, nutrition, exercise, some of those things that we know are super simple, quote unquote, are the hardest things to actually implement in our lives. So yeah, it's really, really interesting. And when with all of this, I guess I want to kind of go back a little bit. A little bit on your own journey with mindfulness, how did you kind of get into this in the first place? You gave a little bit at the beginning, but what has kind of your own path been here within the mindfulness journey and all of this kind of coming together?
Yeah. So going back to that period of time when I was fresh into the world of treating orthopedic patients with orthopedic conditions, and a lot of them were folks with long-term pain or chronic pain, and to be clear, chronic pain just means any pain that lasts more than 3 to 6 months, and it doesn't have to be all the time either. It can be intermittent. It could be a few times a week, or, you know, throughout most of the day, but not the entire day. If it lasts more than 3 to 6 months, technically we would put that into the chronic bucket. I prefer the term persistent pain. We can talk about that if you want, but it wasn't long into the process of starting to understand persistent pain that you start realizing the multidimensionality of it. And one of the more studied and evidence-based ways of helping calm the nervous system and help a person who experiences persistent pain is mindfulness practice or mindfulness meditation. So I learned about it, I heard about it, I didn't know much about it. There used to be this place in town, which I miss dearly, called the Center for Mindful Living. Right down the street from where you're at. It was on Main Street in Washington. And yeah, that's where my world changed, because I started practicing in group meditations. There's a program there that I would recommend for anyone to do, and they have this program online. They have, you know, retreats you can go to, but it's called the Mindfulness-Based Stress Reduction Program. It's very evidence-based. But anyways, I started learning about it then, and met some really great teachers who are, you know, still around, who helped me kind of understand what the practice is all about, the roots of it, the modern application of it. And, you know, my nerdy side wants to understand the science behind it. So I just dove into that. Like, how does mindfulness have any impact on pain? And again, I can explain it, but
yeah, I mean, well, kind of do give a little bit of background on that, because I think that's something that a lot of times all of this like mindfulness stuff, it seems very woo-woo and like untangible to people, but there is so much science behind it. So yeah, give a little bit more of that background, just to kind of ground it a little bit for people, because I think that that's a really a part that's missed sometimes, like in a yoga class or whatever. They're not explaining the science behind everything. So yeah, give a little bit of background there.
Yeah, so you know, I have a list on my phone of like the titles for books.
Yeah.
And I call it the books I'll never write, because I just, you know, my schedule's always so full, and I'll just never have time to do it. I mean, hopefully that's true. Hopefully I'll write some of these. But one of the titles would be Mindfulness Helps, period. And just because it genuinely, I think, is one of the most important things to cultivate in one's life, because it applies to so many things, including pain. So first, I just want to respond to your description of it earlier. It's fine. It's good. No judgment. I think I might just approach it a little differently, to say that it's a quality of paying attention that's always present or capable of being recognized within a person. But it's the busyness of our minds and the worlds around us that maybe impede our ability to connect with that presence or that awareness of the moment-to-moment unfolding of our experience. But it's always there for us to return to. It's like a refuge in the midst of the storm, sort of an idea.
Yeah.
So that, I think, kind of helps with, you know, how it might be framed in the context of pain, because for one, let's just go back to the tension piece. One thing that most folks are just unaware of a lot of the time is the fact that they're holding tension in their body. I mean, I'm holding tension right now in my lower back, and I promise it has nothing to do with the anxiety about this live right now. Just kidding. So yeah, so tension happens, breath holding happens, and everything that happens in our experience, in our conscious experience, is we're capable of becoming more aware of and recognizing earlier or more clearly. That's what mindfulness is all about. It's just becoming more aware of the fact that I'm holding my breath when I get cut off on traffic and my shoulders are up by my ears. I might just be a little bit more aware a little earlier that is happening. It's not then implicit that you have to do something about it, right? You don't necessarily have to relax your shoulders and let it go of the fact that they cut you off. It's just about creating more clarity that is what's happening right now. Something that happened 5 minutes ago is still being held on to. There's something in you that wants to have said no to that person and is still kind of begrudging that it happened to begin with. So anyways, the point there is to say that mindfulness helps bring more awareness to these habits of mind, habits of attention, habits of breath holding, and physical tension in the body. So there's one application for it. Another application for mindfulness is by learning how to meditate, like through mindful. I always recommend starting with mindfulness of breathing. You learn how to just connect with the moment-to-moment sensation in your body of what it feels like to be breathing. And by doing that, not always, but often, there's a sense of peace that can be found. Things don't have to be different in your life before or after the meditation's over for you to just be with the breath right now. So there's a little, that might be one reason, one selling point for a person to maybe explore the practice.
Yeah.
But on a deeper level, and this is where I do try to explore with folks more often, this is where I think it gets, we can go the science direction or we can go through like the experiential evidence, but oftentimes we have things happening in our bodies like pain, and there's a physical quality to it. There's a size to the area that hurts, perhaps, or a shape to it, a texture, a heaviness, a hardness. And all that's true, and you can become more aware of that. But in addition to the experience, there's also a relationship to the experience. So there's the sensation, and then there's how you feel about it.
Right.
And that relationship is often not warm and cuddly or cozy. It's often one of resistance, right? There's something inside that wants to say no to the pain. And I'm not telling anybody that you shouldn't be saying no to your pain, that you should just accept it and love it. But the fact is that you are, and most people are, that there's something inside of them that's frustrated about it, worried about it, disappointed, or they just try to block it out altogether. So by becoming more aware of that internal process that's happening, they can start perhaps shifting their relationship to what's happening in their body, like with the physical pain or the resistance to the pain. And paradoxically, and I know this is, kind of getting in the weeds a little bit, by not trying to change things and just being with what's here, they tend to change more than expected. Because now we're not resisting so much. We're not saying no to our experience quite as strongly. And then for many, they're with practice, and it's not like a one-off thing. You go meditate for 20 minutes and all your pain goes away. It's more like a practice that occurs over time, and opportunities for letting go, for relaxing tension in the body, and maybe offering ourselves a little bit of self-compassion too, for the fact that being in pain all the time is really hard. Yeah. It's okay to say that you're angry about that, or sad, or scared. So anyways, those are some applications.
For sure. And so like thinking about that, because like obviously like people come to me in physical therapy also in pain. But while I can educate them on pain science and everything, like the mindfulness and the way that you approach it is not necessarily my 100% wheelhouse, right? Like that's why this is really interesting conversation, and I'm always curious to learn more about it, right? So, but when I maybe take a more physical approach, where I'm looking at, I mean, I'm sure that you do this in your practice as well, but like how, like, you're looking at things that are like muscles that do have more tension, whether they're actually shortened or they just have like more tension in general, or they have a weakness. There's an imbalance some way in a muscle imbalance and in a weakness in one area or not, or lack of engagement with their core. Specifically, I think about that a lot with low back pain. And how do you start to incorporate the physical practice of, whether it's from a physical therapy standpoint, and those like exercises, or maybe it's yoga or some other type of physical practice in with the mindfulness to really kind of create more of a cohesive, like a cohesive program or a cohesive treatment option for somebody? Because a lot of times it's not just one thing, right? Like there are people who have physical problems, like maybe they have chronic arthritis, or they've got like other things that are, there is something going on. So how do you start to kind of incorporate all of that together with the physical movement maybe side of things as well?
Yeah, I'm glad you asked that, because that's really important. I mean, we're physical therapists, right?
Right.
So first, I'll just say, one of my meditation teachers and mentors, she made the point once that one of her students came to her after class one day and was kind of just, confused. Like, why is this called mindfulness? It should be called bodyfulness, because so much of it is focusing on your body. You're not focusing on what's happening in your mind. We can talk about the technicalities of why it's called that, but it is a body-oriented sort of practice, but not maybe in the way that you're describing, which is like movement oriented and using your body. So how does that, I definitely think there's a huge overlap between these things. So first, as you said, just becoming more aware of your own habits of tension in the body and breath holding. So I use breathing practices at first, just kind of, bringing them a little closer to the body so they're more aware of what's happening inside. If tension is one of the things that's contributing to their pain, and 99% of the time it's at least a little,
Right.
Oftentimes a big contributor. And if releasing tension is then part of the prescription or part of what we want to do to help reduce their pain, and I'm not going to be with you all the time to remind you, are you holding your breath? Then you might want to become more aware. You might want, in your own time and space, investing some time to focus on what it feels like in your body so that you can become more aware of these habits of breath holding and tension and be able to utilize the tools I give, which are beyond breathing, exercises that help loosen and relax the body. Not quite stretching, not quite yoga, but
Right.
more like gentle range of motion exercises to learn how to unclench the fist, so to speak, metaphorically, learning how to gently let go of the guarding and tension that they're holding in their body. But then, and this is the piece that I think, I guess I don't lead off with enough to really help folks see how it connects to the meaningful activities of their life.
Right.
We're going to calm things down first, or at least that's part of my priorities for you. But we also need to build things up. We need to help you build your body back up again. And whether that's, learning to engage different muscles or building strength, endurance, flexibility, balance, all those things are important. But I believe that how you go about it matters more than the exercise itself. There's not like a special exercise program for each person that's going to change their whole life. The exercises are great and you can switch them out for different ones and still get a really positive effect. But how you go about it matters. And if you go about it in a way that's pushing through, which is often the case for folks with chronic pain, they've learned to push through pain for many years. So they're not, they oftentimes will maybe not often, I mean, a lot of the time will, ignore the fact that they're hurting and just push through, like no pain, no gain kind of an idea.
Right. Yeah.
And on one hand, there's a lot of grit and determination. You're able to get gains, you're able to build strength, but you're also getting better at hurting too.
Right.
So mindfulness helps you become more aware of both how your body's feeling as you're doing different things, which allows you to be a better partner to it, to be able to listen to it, understand it, and be able to make choices on how to maybe scale back a little bit. That doesn't mean stopping, but it doesn't mean pushing through either. So it helps you find that middle way. So mindfulness, I think, helps with building the body up, calming the body down, reducing stress, improving sleep. It kind of, I think, affects everything.
Yeah, 100%. And it's funny because like I have a couple people right now, and one in particular was working with him yesterday, and like putting first like kind of low back pain, but also like kind of like a lot of full body like pain stuff going on. So kind of working from the center though, like thinking about core and all of this. And we were going through the kind of 30-minute exercise program that I had put together for him. And, it's funny because he like is super active, strong guy, like does all these things. But, we talk about these certain positions. We talk about core engagement. We talk about, like all of these kind of tiny little movements. And he's like sweating bullets doing, this tiny little movement, and he's like, I never knew that this could be so complicated. And it's like, okay, well, when you really focus on the way that we want to first be mindful of the way that the body's feeling, and then engage the muscles correctly in the correct order, and while also doing the exercise that maybe is targeting the thing that is weaker compared to the rest of your body, or like relative strength wise, he's like sweating bullets, like leaving a sweat puddle on the floor. And it was just kind of a funny, I think sometimes for people, it's a funny realization that it's like, oh yeah, they were like lifting a ton of weight in the gym, or at least for a lot of the people that I see, it's like they might've been lifting a ton of weight. They're actually super strong, but like you said, they've been pushing through, like just pushing and pushing, and they've got really good at increasing that like sensitivity to that pain signal as well. So if they had damage, quote unquote, at some point potentially, then, and they just kept pushing through it, maybe they've healed from a tissue perspective, but then they still have that chronic pain signal that is just like continuing to like show up, because they, never kind of addressed that mindfulness piece, or that kind of starting to really listen to their body within that context. So yeah, it's all so interesting, and all of it like 1000% goes together, definitely. So when we think about all of this, like one of the biggest things that my goal is to really start to create these connections between us as like physical therapists, but then also other health and wellness practitioners. So thinking about maybe the traditional medical system, maybe somebody's like primary care physician or something like that. Maybe it's their massage therapist or their mental health therapist, their trainer, the yoga teacher. How do you maybe either talk to clients or patients about this, and or talk to those other healthcare or wellness care professionals to try to create a little bit more of a cohesiveness between the way that you're either providing care to somebody or talking to other professionals about creating more of a connected care for a patient?
Yeah. Well, for starters, I try to find folks and connect with people who are already doing that, like yourself. I'm a big fan of the leadership that you've shown in bringing the community together in this way, and it's inspirational for me to try to make those connections and find more people who and having conversations. Sometimes we agree, sometimes we don't agree, and that's fine.
Yeah.
But just learning how to make healthy connections with other health professionals who are often always well-intended and always want what's best for the patient, and then finding other health practitioners, whether it might be body workers, everything from like a traditional therapeutic massage to something a bit more alternative like Reiki, or other sorts of, again, considered complementary or alternative care, to a nutritionist or a dietitian or a physician or nurse practitioner or some kind of primary care provider who really takes the time to listen. So I think for me, I'm a bit picky about the kind of folks that I then refer out to, because our system, our healthcare system, hasn't really been healthy in fostering the right kind of, at least what I would consider to be the right kind of approaches as healthcare practitioners to the client or to the patient.
Right.
Really listening and validating and affirming what it is the person's going through, taking the time to help them understand their health situation, their pain, their health condition, their diagnosis. So I want to first find folks that will take the time to listen and really give them the compassionate care that they deserve. And I also try to focus on finding folks that are that their core message is ultimately empowerment. I'm not opposed to other more, let's say, passive treatments or modalities, but at the end of the day, that's just one small part of their week that they spend with you or whoever.
Right.
What are they doing in between? So what are we doing as coaches to help folks take the things that maybe we're talking about and giving them the tools and the strategies to apply those tools successfully for themselves? Those are the kind of people generally that I try to make connections with. But as far as specifics, like, one area, just one that comes to mind for me is I feel like I've got my plate full with the kind of stuff that I want to focus on with a person.
Yeah.
And one area that I know is important is diet and nutrition. It just doesn't enter into the conversation as much as I would like it to sometimes, because there's just so many other things that we're working on. So that's a great space where I might refer out to someone like yourself. Well, I know that you incorporate that into your approach, personally and professionally. And then with other, health practitioners who can look at a person's profile in that way and make suggestions.
Yeah.
So I don't know if that quite answers the question, but yeah.
No, and I think it is like, it's an ever evolving thing, right? Like, I also, like, part of the reason that I started the Human Health Collective and then starting this like mastermind community and group is because I felt like two things. One, I was like, where are these people? Like, I and then I don't know, sillily, I don't know if that's a word, but like I was like, okay, maybe these people would just like appear in my life somehow. And then I realized, oh wait, no, actually you have to like make effort to go like find these people. And then when I started looking into whether like I started trying to go to more networking events or different things like that, there wasn't really something that existed that I was looking for. And like ultimately that's why I created the Human Health Collective, and that's why like I'm starting this, because I have now had so many conversations with people like yourself or other people who have attended the Human Health Collective who really resonate with this more of like a whole person approach, but there's just a lack of connection or like knowledge of who else is out there that we can really work together with to help create more of this like coordinated healthcare system, honestly. And that's like, I mean, I have a lot of really big goals, but that's one of them. Like, honestly, how do we create a new healthcare system in the US? And like, that's a huge question. It's a huge undertaking, but it's like, obviously it's broken. Like if people are here, then they probably already know me and they probably know you. And like, we know that like it's broken. It's not serving anybody except for the pockets of the insurance companies. And, you know, you talked about how, you know, maybe a professional might not get to spend time with a patient. And a lot of times I don't think that that's any malice of like a professional. Many times it's just the nature of the way that our healthcare system has been built and created, and they are completely stressed and overwhelmed. And like, I know probably from probably in your experience as well, and like my experience within the insurance-based world was that, you know, I just didn't feel like I could make any difference at all because you were under all of these constraints of what that kind of overarching healthcare system was impeding on. And so I think it's how do we create these conversations? And for me, you know, I'm still trying to figure it out, right? Like we're still doing it, and it's going to be an ever evolving process for everybody. But I do think it's so important, and I think it's really important to start kind of connecting the dots for people, because like as PTs, as coaches, a lot of times we're on that like front line, I think more. And you know, we might be able to be like, hey, have you thought about maybe like seeing a mental health therapist, or this might be something that could be addressed by somebody else. And so that's, you know, that's something where my brain goes is then, okay, like, well, who are those people? So now I need to go find them.
Absolutely.
Yeah.
Yeah, I totally agree. And just real quick comment, you know, I think our health, I mean, there's this, well, it's a term, the biopsychosocial model.
Mm-hmm.
Many practitioners may be familiar with that, maybe not so much the public, I'm not sure. But it's just a reminder for us as professionals to really look at the whole person. And I spend a lot of time in the bio and the psycho. The social part, I think, is also really important. And
Yeah.
And I think the way you're constructing the Human Health Collective and this mastermind group, I think it's really beautiful because it really puts the emphasis on the community side of this whole picture, that a person's individual health is in part going to be dependent on the health of the community. And I think there's a lot of ways to try to change the system outside of just straight out revolt.
Yeah.
But I think one of them is to replace it with something better. Mm-hmm. And what you're doing and stuff like that, I think are going to make the difference. Yeah, so you know, keep it up. I hope it continues to grow because I know there's a need there, and you see that need, and your courage to step into that space is really, really great. So thank you.
Well, thank you. I appreciate it. And I appreciate all of your like, you know, help with this and like contributing to and being on the panel and everything, because that makes such a big difference too, to kind of continue getting the word out about all of this. And I had a conversation earlier today with a woman who's, I think it's called the Sunrise Collection, and I'm probably going to have her on one of these lives as well. But she's creating something that's also very interesting, where it's bringing funding into non-traditional practices basically, and being able to help provide funding for people who might not be able to afford these kind of quote unquote non-traditional or more cash-based services. So that was really interesting. And she said something today that then also resonated, which was like she couldn't in good conscience like kind of like go out and just like tell people how terrible everything is without having a solution for it. And I feel like that's like part of it is, you know, we can go on and say like the system's broken, but if we don't do anything about it and, you know, work towards something that's different or have something that's better to replace it, then, you know, then we're just all talking. So
100%.
it's kind of a whole other piece of it.
That's the point.
Yeah. So I wanted to think about, so we talked a lot about like breath work, and kind of the like different ways for mindfulness. Something that I mean, you're an entrepreneur, you work for yourself, I'm an entrepreneur, work for myself. And like we kind of said before, some of the simplest things are the hardest to implement. What are some like maybe super like small, like actionable things that somebody could do maybe in the morning, or, you know, some like a 5-minute action for them to really kind of bring this into their daily life, especially for that like super busy, like entrepreneur, career driven person who's like, I just got no time because I'm doing 1,000 things and my brain is in 1,000 places.
Okay. Yeah.
This one might be for me.
Yeah. So what's the thing you can do for 5 minutes every day that changes your life? So first, you know, like I said, the breathing is not a bad starting point.
Yeah.
You know, it's not meditation per se. I mean, so I have a couple breathing recordings that I've made. You can find them on my YouTube channel or
on YouTube. Yeah, and we can. And you can post in the group as well, like tag them underneath this so that we can have those links underneath, and people can go find those, because that would be great. Yeah.
Awesome. Thank you for that. So I'll definitely put some links in, but
yeah,
you know, again, I just kind of want to give folks the option that there's a lot of different ways to work on your breathing. I like the style that I use, which is called the deep and easies. And I give things dumb names like that just to kind of, you know, be a little bit more memorable. It's basically a deep breath in, followed by an easy, restful breath out, where you're not trying to control it. You're not trying to slow it down. You're not trying to go into the nose, out your mouth unless you want to. It's intentionally designed to be less regimented and technical, because sometimes that's part of the problem, is that we're trying so hard all the time. And this is about letting go of that and letting the body breathe out for you, and just letting your body exhale and letting it soften along the way. So doing that recording, again, we got two. One's about 5 minutes. The other one's about 8 minutes. Do one of those every day, and then call me in a week. And you might say, Jason, that was a waste of my damn time. I want my money back. And I'll say, it was free. What can I tell you? Just don't do them anymore. So I think that's a really great starting point. You'll start noticing things that you maybe hadn't noticed before. Again, those breath holding patterns, those tendencies to hold your breath in certain situations, around certain people, in certain environments, when you're about to do some specific movement that has previously been very painful, and there might be a bit of fear inside, maybe not consciously, oh, I'm afraid to move. I don't mean that. I mean more like your system has determined that this is not a safe activity. You shouldn't bend at the waist. You shouldn't lift heavy things. And then boom, the breath holding happens, and you notice there's something in me that's a bit nervous about this activity. So it's just an awareness opportunity to learn more about yourself and what you're up to inside, and the fact that your breathing can help a little, sometimes a lot, with managing symptoms and reducing pain. And and I think it helps in other ways too we can talk about. So that's one starting point. Another starting point that I think would be relatively low level. One of my favorite metaphors. So anyone who's ever, you know, talked to me for any length of time has probably heard me talk about the bear. And the bear is a metaphor I've been using for many years. And the idea is that when you're doing physical activity or exercise that flares up your pain, that's like waking the bear. Okay. And what I like to remind folks is, even if you push through and you get these activities done, whether it's day-to-day tasks or physical activity or exercise, if you build your body up and you get things accomplished, but along the way you're waking the bear and flaring up your pain, you're going to get better at hurting too. You're going to create the conditions that makes the pain more persistent. And I'm not judging or blaming anyone, because again, they have priorities and they have other things they want to do and need to do in their lives. So you might just start taking a little bit of a loose inventory, like where can I maybe scale back a little bit? So load management is the term. How are you managing the loads you're putting on your body over the course of your days and weeks? And how can you maybe take perhaps a couple steps backwards to take 3 or 4 steps forwards? So one example might be I have knee pain or hip pain or back pain, but I really love to walk. It's good for my mental health. It's good, perfect time of year for it. And I don't want to say no. Plus I walk with my partner or I walk with a friend, and I don't want to miss that opportunity. It's like, okay, maybe just for the next week, you might just take 1 day off or do the same walking, but maybe 75%, 50%. That might be a bit scary for some folks. Like, well, then it's a slippery slope to doing nothing. It's like, not really. Take a little time to scale back, allow your system to calm a little, and allow maybe the symptoms to subside to a degree, then build it back up again. But you do so by poking the bear, just not waking them up every time. And that goes back to that notion I mentioned earlier about being a partner to your body. I think it really matters that we treat our bodies with respect and dignity and kindness. And that's not just because of, some ooey gooey, like you should be loving to yourself kind of a thing, which I do believe, but it's just good strategy. It's just a good strategy. If you want to do the stuff you want to do, I'm an optimist about movement. I think we can build our bodies up and allow it to adapt in lots of different ways.
100.
So you might just scale back a little bit and allow your body to adapt to these things a little bit more slowly, a little bit more patiently, a little bit more judiciously. And I don't, that again, that's not like a one small thing kind of, it's a shift in attitude or shift in strategy, but it doesn't take a whole lot of time to kind of get the data to make that change. So maybe the one recommendation there is maybe an activity journal. It doesn't have to be super thorough, just 2 things. What did you do today? And how did you feel today? That's it. Physically, what did you do? That can be everything from exercise to daily tasks to housekeeping. And how did you feel? It's like pain was through the roof, or I felt relatively okay. And then now you've got data. Now you can kind of look back and reflect on that. Say, where am I pushing too hard? Where could I maybe be pushing a little harder? So I think those are a couple of things. And then one last point, and this is just something you said, and this is kind of like a hair split moment for me. People don't have the time statement. I like to remind folks that that's never true.
No,
and it's not like, I mean, it's a matter of choice. You're making choices all the time. And I don't start by saying you're making bad choices. In fact, I never start with that. I always start with, what's the most charitable thing you can say about the choices you're making? You're putting other people's needs above yourself. We might call that people pleasing. We might call that a lot of different things. But it just reflects that something inside of you really cares about human connection, really takes your responsibility seriously, wants to do really well. Something inside of you wants you to be seen and appreciated for how hard a worker you are and how selfless and compassionate you are. Does it come with consequences? Yes, it does. But let's start with grace and compassion for the part of you that pushes. And then maybe start recognizing maybe there are some places in my life where I can say no so that I can say yes to my body. So those are maybe a couple little but not so little things, I guess.
Yeah, no, definitely. Maybe quote unquote simple, but
right.
Not easy.
Sure.
And that's so true. Like I was just talking to somebody the other day, and I was like, I hate these 30-minute time blocks in my day, because I feel like even though 30 minutes you can actually do a lot in that time, but I feel like I can't get anything done in 30 minutes. Like it's not a full workout. It's not a full deep work session. I can't kind of ingrain myself in what I need to be doing for work. So I find myself scrolling and doing these silly things that I'm just hitting my head. I know I shouldn't be doing this. But I just, there's a resistance there or something. So there's always time in the day. A lot of times we just don't do enough, myself included, self audits essentially of what those time blocks look like, or like where we might be able to actually like implement these like 5 minute, like the 5 minute video that you have or something in one of those. I mean, 5 minutes out of 30 minutes, like that's perfect time to do that, right? So there's so many different kind of different ways we can find those little exercise or mindfulness or whatever practice that is that you kind of need in those times. So that's really good
Can
point.
I add one little thing there? Whether it's the person who maybe scrolls, which that's one of my ways of self-care. Maybe it's not the most skillful way all the time. Maybe it's not the most productive way, but it's a way of helping, let's say, ease some of the overwhelm that I have in my life.
Yeah.
Whether it's that person who sees their behavior as, well, I know I shouldn't be doing this. I ought to be more productive. I ought to be doing my breathing or doing some yoga movement that Libby, the person that pushes too hard and doesn't take the time. And I know I should be saying no more. And I know that I should cut out a couple more things, and it's okay to send an imperfect email or whatever.
Yeah.
One of my favorite things or mantras to remind folks of is that shame leads to more of the same, but grace leads to growth.
I like
if we
that.
start by holding ourselves to these really harsh levels of expectation, or follow that with harsh judgment when we don't meet those expectations, it tends to lead to more sense of I'm not doing enough, I'm not good enough, I'm not enough in general. Right. I ought to be doing more of this, I should be doing less of that. Tends to lead to more of the same behavior, because ultimately it creates more sense of, again, low self-worth or just frustration, stress, etc. And then we go right back into the same behavior that we were trying to do less of. But grace leads to growth is another way of saying, let's start by affirming the thing that you're doing. It's like, what do you get out of the scrolling? Yeah. You don't scroll to feel worse. There are people in my life close to me who don't like when I say this, but smoking cigarettes is self-care. I'm not saying nobody needs to be told at this point in time, I don't think, that it's unhealthy. It's not good for your body. But no one smokes a cigarette to feel worse. Yeah. They do it to feel better. So what is it giving you? Maybe a sense of calm, maybe a step away from the busyness of your life or your job. Yeah. It's literally taking deep breaths, to be honest. Like, you're taking deep breaths in when you're smoking. So let's start with grace. Like, what is this giving you, and what is it actually the answer to? Because it's not the problem, it's the answer. Right. So if we start with grace and we realize that maybe there's an underpinning of stress or anxiety or frustration or a difficulty saying no somewhere, maybe that's a better starting point for then making change, not from shame, but from a place of grace. Yeah, 100%. I absolutely love that. And I feel like that is gold. That's so true. So true. I love that. Okay, so in just like the last couple minutes here, we got to close out here just a bit, but two more things. So one, if you have any like resources or books or podcasts or other things that you might recommend to people if they're more curious to kind of learn more about this, some of your favorites. And then two, where should people kind of go to find you, to work with you, to go to your resources that you have? Where can they find you on social media, etc.? Okay. All right. Be concise, Jason. Oh man, where to start? So there's so many good resources out there. So I'm just going to tell you some of my favorite thinkers, and may not resonate with everyone. One of my favorite thinkers and authors and clinicians is a guy named Gabor Mate, Gabormate, and he's written a lot of books, including a book called The Myth of Normal, is his most recent one. And I think he does an excellent job of helping make the connection between stress and our health, and not just general life stress. And there's a lot of misunderstanding about what stress truly is and the difference between psychological perception of stress or feeling stressed and the stress response being overactivated, even on a mild level over a long period of time, can have really negative effects. And I think our society really contributes to that in lots of ways, not to mention the way we're raised and the things that we believe about ourselves, all sorts of that. So anyways, Gabor Mate is a fantastic one. For the clinicians who might listen, if you're anywhere near the area of rehabilitation or PT or chiropractic care or anything like that, Greg Lehman is one of my favorite thinkers. He's just a great resource for understanding the research and really understanding, he's where movement optimism comes from. In fact, he's where the bear comes from. His expression, if you'll forgive me for using some coarse language, you can poke the bear, just don't hump the shit out of him, is his message. And I really like that idea because he works with athletes who just kind of push their bodies way too hard a lot of times. So Greg Lehman's just a real interesting listen for those who are more clinical minded. In the world of like mindfulness and self-care, there's so many things. I think one really good starting point maybe is Radical Acceptance by Tara Brach. That's one of my favorites. And just for the general stress nerd who wants to learn more about it, there's a lot of books there, but one of my favorites is Why Zebras Don't Get Ulcers. So that's a good one. Okay. As far as my own stuff, because I know we got to wrap up. I've got, you can come to my website, insightempowers.com. There's a lot of, connection points to individual offerings. I do, in-person work, virtual work, but I also do classes. I like group offerings as well. So I have a couple of classes. One's a meditation class that meets every Tuesday called Coming Home. It's donation based. And then the other one is called Caring for Pain. It meets first and third Thursdays of every month. And it's $20 a class, but it's, first class is free. So anyone who wants to just taste it and see what it's all about, it's a good way to learn more about your body and about pain and learn how to, and do so in a way that's in a group environment where you feel supported and seen. Yeah. And then the thing I'm really excited about, just if I can take a moment, two things. One, I got my open house on Saturday, this Saturday. Yes. Yes. So I'm hoping to, get a good turnout there. Just come say hi. This is just more about celebrating the starting of the business and the community in which it grew. So this is just celebrating all of us, not me or anything. It's for everyone. And that's in Hickson. You can find the details to that on my Facebook page or website. The last thing is I have a upcoming workshop that I love to do. I do a few times a year called Calm Your Pain. And the next one's going to be at the Hickson Community Yoga Center on Saturday, December 13th from 11 to 1. It's also donation based. So, basically free. Just come join, 2 hours roughly. And we'll talk about some of the stuff we talked about here, giving folks a clearer path forward for how they can be better partners to their body and calm stuff down.
Yeah, that's amazing. Well, I'm really excited for all of the stuff that you have going on because you are doing so much for the community with everything that you do, from your group work to the workshops and everything that you put on. So I'm super grateful for you and all that you do there. And I know that there's several more conversations to come because this just the beginning with everything. And thank you so much for taking the time out of your day to come join on this live. And if you have any other links or things and you want to kind of put it in the comment section below here, then we'll have that. And then for anybody who's watching, like if you want to comment on the video and ask questions, then we can kind of dive in there as well, and feel free to reach out to Jason or myself, and we can connect you in whatever way that we need to. But again, thank you guys so much for being here. Thank you, Jason. And we will see you guys next week on the next live. I'm excited. All right.
Thank you, Libby. Thanks.